Welcome back to another episode of Black Facts. I'm sure you've heard in the news how Black mothers have been experiencing poor birth health outcomes. Instead of focusing on what's not gone right, we're going to learn from one of our guests about the supportive healthcare professionals that are working to improve the birth experiences of Black women. Aiyana Davison is a certified nurse midwife and a women's health nurse practitioner practicing in Southern California. While she's been working in the hospital setting for the last 6 years, she recently started her own home birth practice, the Village House. Today, I have the pleasure of speaking with Aiyana and learning more about what she does as a certified nurse midwife. Welcome, Aiyana.
Thank you. Thanks for having me, Michelle.
Oh, you're very welcome. I'm so excited to learn. So, what does a certified nurse midwife do?
Well, quite a bit. As a certified nurse midwife, my scope is fairly broad. We are notoriously known for helping people birth their babies, have get prenatal care, postpartum care. But what goes beyond that is we also offer contraceptive counseling. We can prescribe medications and also offer various reproductive health treatment and assessment. So I see people for a wide variety of things, not just the baby part, which is a fun part, but there one of the sayings is we see people from menses, beginning or menarche to menopause. So when you first start your periods, all the way through to menopause. So we also, help people along the major life transitions that they have.
Wow. Okay. So please explain to me then what is the difference between a nurse midwife, a doula, a OBGYN? It's like,
Yeah, it's like where do I get my care? So we are certified nurse midwives, and I should probably break it down a little bit more as well. So midwifery is like an umbrella term, and there are various routes to midwifery. So you might find a certified nurse midwife, a certified professional midwife, or CPM, a certified midwife, CM, or traditional midwife. And we all stem from the same place. However, because of governing boards and how medicine has kind of developed in America, we all kind of split paths, but do the same or similar work. But the nice part is, we like to say that all people deserve a midwife when they're pregnant or considering their family plans. And some people need or require the help of a doctor, or a physician. So we really focus on low risk care, people who have, not super high risk conditions. I hate to use the term normal, but like a pregnancy that doesn't have any complications. We typically see people, and so the difference between myself and like an OBGYN, they also can see low risk. However, their specialty is in like the abnormal. So once I can diagnose that something is outside of my scope, I would refer to someone to a physician. A lot of folks think that midwifery is new. It's actually probably one of the oldest professions ever. And so, we are here, we are very much alive and well. And we are also trying to like close these gaps in care where people, there's healthcare deserts where people don't have enough care. And, as we have more providers, we're able to offer that care. So between midwifery and then the physicians like an OBGYN, they're going to get into like perhaps if someone needs a C-section or someone needs diabetic management or they have preeclampsia or really high blood pressure or other conditions in their pregnancy or even in their, well woman, landscape, they're going to address those things. A doula, which it's funny, I just got a text today and someone was like, "Are you still doing doula work?" And I'm like, "That's a tricky question." I was not ever doing doula work, but I continue to do midwifery work, which is closely aligned with doulas. So doulas are helpful coaches through usually through pregnancy and labor and postpartum. There are different types of doulas. So there are people who focus on like death and dying. Like I've heard of death doulas as well. But when we use the term, generally we're talking about pregnancy and postpartum, and they really help people manage through labor, especially like early labor until a midwife can get to you or a physician can
Okay.
get to you. They help you prepare for postpartum, and they're just a valuable resource for folks who are going through family planning and need that type of care. So they're not providers, they're not offering medical care, so they're not assessing and diagnosing. They might be assessing just to see how they can help, but they're not diagnosing and treating. They are there to support someone, the family through this process. Mhm.
Okay, you've said a lot. I need to, I'm trying to like figure out where I want to start. You
No.
said that you assist with preconception.
Mhm.
So, say I'm a young woman and I'm interested, I kind of want to talk about what my particular options are, but I need, I just need checkups like a pap smear.
Yep.
Would you be able to provide that type of care for me?
Absolutely. PAPs are probably one of my favorite things, especially like a first time PAP, because I remember my first pap smear and no one explained anything. It just happened. And so I really like to, create an environment where people, number one, feel safe, which is hard to do in a short amount of time, but it can be done. Explain what's going to happen. Let whoever the person is, see the tools that we use if they want to, and even if they want to take a look at their cervix, we can get a mirror, or if they want to use their phone, some people will ask to do that. But yes, we do. We do screening for STDs or sexually transmitted diseases. We also treat them, and then also your Pap smear. It's not annual, but every 3 to 5 years, depending on your age, we help with that. And then if someone wants to know their options, yes, of course, we can go through the list, and then I can also, for those that need placement, I can, like an IUD, an intrauterine device, I can place those, we can remove them, we can troubleshoot if there's
Wow.
health issues. Yeah. So there's quite a bit that that midwives do.
Wow.
Yeah. So, and it's really exciting because teaching is very much a central part of midwifery. And
Mhm.
so personally, I love to teach people what they're getting into, like walk them through it and what the expectations are, the risks and benefits. And so, damn it, and I try my best to explain everything that's happening.
Oh, okay. I did not realize that. I knew that you kind of helped with, I thought it was like like right when before they got pregnant or right when they got pregnant, they knew they were pregnant, they could come to you, but not
Mhm.
what you're doing,
Right before, yeah.
Yeah, that's okay. Wow, that's wonderful.
Yep.
See, I'm always learning stuff. And then you talked about like it's the oldest advanced nursing practice, really.
Mhm. Yeah.
And why do you think so? Why, so many of us don't really know what, you know, nurse midwifery is because it's the old, right? Why
Right.
don't we know about it? And then why, when we do hear about it, we're a little hesitant, like, oh, I don't know, like it's kind of mythical.
Right,
I
right.
don't know how to explain it, but
Yeah. It's like, what is this kind of sorcery that's
right.
happening? Well, a lot of that's rooted in the foundation of America, and I'm gonna try to keep this brief because I could go on
Okay.
and on about this.
Okay.
But if we look at the history of America, even indigenous folks, but also Black Americans, as enslaved folks, we had to have someone to come and help us have our babies. And it's not that like midwifery developed out of that, it's that we were doing that in like the homeland, like the continent of Africa. So we were helping people along their way in their journey, long before arriving here or being brought here. And so the Deep South is full of a rich history of midwifery where midwives were serving maybe several counties, like maybe one or two midwives, or just really just one, and keeping Black folks alive, as well as the plantation owners. So there's this rich history there, and we're doing things out of tradition, that are rooted more holistically, because we didn't have access to, what little medication would have been at that time. And as we see the evolution of midwifery, we also like that parallels with the evolution of modern medicine.
Mhm.
So as like hospitals and physicians became more popular, especially amongst the white community, like it also was something that like Black people, in order to feel as if we're keeping up, we
Right.
to physicians and hospitals, although our traditions are deeply rooted in midwifery. So we see what happens in the 1930s or 40s is the Shepard-Townsend Act. I might be misquoting that, but basically, this was an act to say that midwifery was unsafe, unsanitary,
Mhm.
and in order to continue, midwives would have to follow a certain protocol. And for those who kept up with it, they could continue on as certified nurse midwives. Those who did not, it was illegal in some parts to continue practicing. But of course, like, who do you turn to? Oh, if a white physician tells you he's not coming to your birth, then
Right.
like, who comes to your birth?
Right.
So and also to point out too, midwifery was something that was appointed. It wasn't always like I choose to be a midwife. We find that there are quite a few stories of midwives in the South who did not want to be midwives, but the calling was over them. So so going back to your question, why we've kind of been what seems like hidden is because of a lot of the political and then also this medical industrial complex, theory of how things should work. And then we as Black people tend to believe what we're told by physicians because they're seen as, a higher level of care, somebody who's supposed to dictate to us what's supposed to happen. However, like I think one of the foundations of the philosophy of midwifery is that you are the expert at your body. We're here to guide you along the way. Um, so when you come to us with your, whatever the concern is, the condition, we really try our best to navigate with you based on what you're telling us and believing what you say. So I hope folks, when I know one of the questions is going to be like, what do you want folks to know? But like, I hope folks know that like they are the expert at their body and that we are here to guide them and not like be a god over them and dictate to them what needs to be done.
So I'll go back to I'm a young woman.
Hmm.
I find out that I'm expecting
Hmm.
and I'm super excited. I come to you, say I'm just in my first trimester.
Hmm.
What would that look like?
Yeah, I'll take you through a little journey. So depending on the setting, because we have many settings where people might want to have their baby home, birth center, hospital, and certified nurse midwives can practice in the hospital. Some of the other types of midwives that I, mentioned before, don't have, privileges at hospitals, but it all kind of looks very much similar. So when someone comes in, we verify the pregnancy. So even if you've taken a test at home, we say, hey, congrats. We're going to confirm here. In the hospital setting, we can do an ultrasound. Midwives can also do ultrasound to verify the pregnancy and do your early dating ultrasound. We also order a number of tests, your prenatal labs, which is a standard across the board. So, with my own home birth practice, I draw my own patients' labs in their home, which is nice and convenient.
Yeah.
And it's comfortable. It's not the rush of a lab, but if some people need to do that, they can also get their orders placed by a midwife and go get their labs drawn. We talk about history, like what your history looks like medically, surgically. Then we talk about your family history, just in case there's something we need to be aware of. And we're also like, we're assessing, listening to you, and kind of listening for things that might be clues to needing a higher level of care, right?
So
So,
let me ask you this. I'm
yeah.
sorry to interrupt you, but I know a lot of Black women have fibroids.
Hmm.
Would that make me be considered high risk, or would I still be potentially low risk?
That's a great question. So it depends on the type, location, and severity of your fibroids. Many Black women find out about their fibroids because they got pregnant.
Mm-hmm.
So unless they were having trouble with their periods before, which by the way is something we can also help manage initially as well. So if there's irregularity cycles, pain, heaviness, bloating, that pressure, we work them up and then send them to ultrasound for, whatever the case is. So having fibroids does not rule you out of midwifery care. However, if you have very large and numerous fibroids, especially if they're going to prohibit you from having a vaginal birth, because sometimes they can, then we would say you are high risk because of that. Otherwise, we kind of just keep an eye on things and make sure your baby grows well, they're in the right position, and that especially when it comes to birth, that your bleeding is stable, because you are at a little higher risk for like a postpartum hemorrhage. But it doesn't mean you are ruled out of midwifery care. Yeah.
So I want a midwife now. I'm past that age, but I'm pretending.
You're not. You're not. Like I
Yes,
said,
I am.
well,
Um,
of course. Understood.
well, I'm saying I don't yet. No, I don't want.
Got it.
I'm happy with the one I have.
Yes. Understood.
So say that I want to, I'm interested. I'm a
Mhm.
young woman and I'm interested in having a nurse midwife. How do I even go about, because again, right, it's not
Yeah.
something commonly you're told, oh, you talk to your OBGYN and you tell them, hey, I'm pregnant, can I come in? Or I think I'm pregnant, I took a test, can I come in and get confirmation? And then we kind of go from there. So if I wanted to turn things around, now that I've learned, from you what a nurse midwife can do, how do I go about accessing one?
Yeah. That's the other thing is like this accessibility and visibility. Like, where are we
Mm-hmm.
when you get to us? And again, we are here, I promise. So there are some hospitals again that employ midwives. So it would be important, again, giving a financial situation or your desires, whatever comes into play, your location as well. It's a good idea to ask your local hospital or your OB/GYN, if that's the first appointment that's made for you, ask them if they work with midwives. Additionally, a simple Google search, I don't always rely on this, but Google search in this case, if you type up midwives in your area, you probably will find a few birth centers or a list of midwives that are offering care that are local to your area. There are some directories, especially for Black midwives, because we tend to be the unicorn of midwifery. Like, to find a midwife, one, and then to find a Black midwife, and then on top of that, to find a Black midwifery group that has a birth center is very rare. Out of like hundreds or about 100 birth centers that are across the nation, I would say only about 13, maybe 16 are Black owned.
Wow.
And I'm trying to change that for Riverside. But a Google search can help you. And then also word of mouth. I find that a lot of people who are thinking about getting pregnant or are pregnant and early in their stages, they somehow talk to one another. And so find out from your friends, did you get midwifery care or do you know someone who did? And if they like them, and then that way we can set up a consultation. And then some midwives have just freestanding clinics. They may not do like a home birth, but maybe they just see you for a portion of your care and maybe attached to a hospital. So again, asking the hospital group or clinic where you're going to be seen. I want to say as well, there might be some pushback because historically, again, given the history of midwifery that I talked about before, there's like a lot of resistance from many from the medical field. I won't say everyone because that's just not true. There are plenty of physicians who support midwifery care, but there might be pushback or you might see a face or an eye roll because this has been experience that I've heard about before. But don't let that deter you from looking for us because we are out there and we want to help you.
I love it. Wow. So, are there any other resources or events? We're scrolling down on the screen so everybody can find you. You are no longer going to be a unicorn. least not in Southern California. People are going to be able to locate you and find you. But are there any other resources or things you'd like to share with us so we can make sure that, again, we're knowledgeable? We know that we can go and ask our local hospital or our current, OBGYN if they, partner and work with nurse midwives.
Mm-hmm. Yeah, so for myself, you see below the Village House. We're trying to really get going and offer services locally to Southern California. And then the Vagina Chronicles, which is more of an educational platform, because I found that I was seeing people who just really didn't know about their body, and I wanted to give them like more information so you go into your appointment prepared, whatever the appointment is, whether it be like I have this weird discharge, or like I'm pregnant, or I'm postpartum, whatever the case is, or I'm in menopause, like, all of those things. So that's a resource. We also have what's called a doula collective. And that is, well, I should say a birth worker collective. So locally to Southern California, Sankofa is the name of our birth worker collective. And it's a collective of doulas, midwives, mental health professionals, physical, pelvic floor physical therapists, a wide variety of professions that all kind of intermingle in the world of birth. And in this, we provide resources to people in order for them to have successful birth outcomes, and also just go through again that, life transition, whatever it is that they're going through. So looking out maybe locally for a birth worker collective or a collective of doulas. Most of the major cities might have that as a resource. Trying to think of what else would be good for. And then you had mentioned, I think you mentioned events, but every year,
Yes.
every
Because I
year,
know, I know that this month is Black Maternal Health. Well, there's a week
yes.
that's celebrated, and a lot of things are going on. Are you doing anything? Are you going to be visible so people can come out and meet you?
Yes, yes. So Black Maternal Health Week is every April for the last 6 years, and this is put on by another resource, Black Mamas Matter Alliance, and they are an organization that really is targeting some of these major issues that's happening with Black birth and postpartum and infants. And this year we're putting on an event, and it's under the collective that I just mentioned. And this will be April 16th in Fontana at the Cypress Neighborhood Center. And we're just going to have food. We're going to have fun, resources. Black Infant Health will be there, IEHP, Sankofa, I'll be there. So many organizations, WIC, just the myriad of resources for people to have. The reason why we're doing this, and the reason why I'm trying to organize this too, is because people need to know we're there. Yes, the word of mouth works, like I mentioned. Yes, social media, but like to see people in person and gather and get the things that you need and know that they're like physical bodies and humans there to help you just is, I think, a comfort. And honestly, the way that like the collective works is, if I don't have something for you, somebody else will, or I'll know somebody who does. So we work it out so that our community is supported.
Wonderful. I meant to ask you, you were talking about helping and really being there to support the mother, but I know that you're not just there to support the mom, you're really there to support the family unit. Can you talk a little bit about that?
Absolutely. So, uh, you know, whether it be a partner or sibling, you know, a grandma, an auntie. I've had a room where it's like as big as this room with like 5 people in it to support like somebody who's going to have a baby. And so I don't turn them away, as I'm building my home birth practice, my clients who have younger children already, I get them involved in the care. The partners are involved. So it's, this is not the reason why I named my business The Village House is because it does truly take a village, not only to raise a child, but for us to thrive in life. And so I try to make sure that everyone feels included. And, it's a really big difference from the hospital where, and that's where I've worked for a very long time, but it's kind of like the partners will come in and sit to the side, and it's, I give them the eye, but they feel like it's maybe just the mom or the birthing person's time, and I try to get them involved. When you're at home, you're in your element, you know, or under the midwifery care, we kind of just try to reel you in, like, so that everybody's involved, because we need to know about if y'all having arguments or you're having the best day of your life. We want to know about it because it impacts your health, right? So
Mhm.
we get everybody involved. It's a hands-on, appointment, especially when there's a baby involved. But I welcome anybody, that whoever the client or the patient is, I welcome whoever they want to come in. I've had people bring like their best friends to their pap smears, and I'm like, good for you, because we all need that emotional support. So it's not just about, it is about the individual, but it can be about their circle and their network as well.
That's beautiful. That is so beautiful. No, I've not really thought about it like that. These are events in our lives
Mhm.
and experiences. And yeah, oftentimes, you're kind of like, oh no, but you have to do this by yourself. When really, you're saying that we don't. It can We can have our support there, the people that are going to help us be comfortable in, sometimes it can be a very stressful event having birth, and
Mhm.
um, you know, having your family and loved ones around you to be able to support you, and then having someone that is skilled to
Mhm.
make sure that you bring this new life in safely
Yeah, yeah.
is a beautiful thing.
That's
So
true. And then also, like, when we're going through these things, sometimes we are it's so much anxiety or nerves that we forget to ask questions. And if you have someone with you who you've talked to, like, "I'm going in and this is going to happen,"
right.
maybe they remember or will remember the appointment so that they can like review it with you after. I am a firm believer that folks, whether birthing or just getting basic care, you're going to ER or urgent care, you shouldn't go alone, which made, the past couple years very difficult, right? Because people are
Mm-hmm.
in the
Mm-hmm.
hospital alone and they're staying in the hospital by themselves. So it's super important that we have, an advocate or someone just to support us there. So maybe we have that, second that second brain there to ask questions and get the concerns addressed. So yeah.
Well, I appreciate you. Anything else? Anything else you want to share with us?
Ooh. Um, like I mentioned before, you're the expert at your body. We're here to support
Yes.
you. We're guides, not gods. Um, Midwives. So while we are very valuable to, the solution of what's happening with the Black maternal health crisis and these deaths and poor outcomes, we're part of a team of things that can happen. It's not just one thing. Like, it doesn't solely rely on doulas. It doesn't solely rely on midwives, and it's not solely the blame of physicians. There are people who need to reckon with and to accept, their part in the matter. But I think if we can all work together collectively, we'd see better outcomes. And just remembering that folks are human. So if you're provider watching, remember it's not just another number in front of you. This is someone who
Right.
goes home to a family or, their dog, their cat, whoever, but they are a person too. So how would you like it when you're sitting across from someone? How would you like to be treated? Um, and just, we're here. Midwives are here and alive, and we're well. That's what I want
Yay.
people to know.
Thank you. Thank you, Aiyana, for joining me on Black Facts. And just thank you for educating me as well, because I really went into this not, there's a lot of things I did not know about nurse midwives. And I just really appreciate your thoughtful explanations about, the breadth of services and support that you provide to women and to our village. And I love that you named your new business, the Village House. That's beautiful. And that's what we are. You're right. We need a village, right? We need a village to walk through this thing called life. So thank you so much for, like I said, sharing important and necessary information that we need to know so that we can improve the health outcomes or the birthing outcomes of our Black mothers.
Yeah.
And I want to just say that you can find Aiyana on her social media platforms. We've been streaming them all throughout the episode. So please, please, please visit her at the Village House Wellness and also at the Vagina Chronicles. I'm going to go look that up myself and see, I'm sure learn more stuff I don't know. I think I know my body pretty well, but there's always room to learn new things, right? I just want to thank everybody for joining us on this episode of Black Facts. Stay tuned. Please like, share, and subscribe, and stay up to date on our new and upcoming episodes. And please join me next time for another engaging conversation so we can all know the facts. Take care, everyone.